Lung cancer often masks itself behind symptoms that resemble common respiratory illnesses, making it challenging to identify in its early stages. However, understanding and recognizing these subtle yet persistent changes can make all the difference.
The early signs of lung cancer, a lot of time, most of the time, it is overlapped with the symptoms of common long-standing respiratory diseases, and in some cases, it might overlap with infectious diseases like tuberculosis also. So, lung cancer, the early signs are usually ignored by the patients, thinking that this cannot be lung cancer, but it is a very killer disease. So we must emphasize the early warning signs of lung cancer. One of them can be chronic cough, and in any cancer, the cough is gradually progressive. It is persistent. It stays as it is and does not improve by medications that are used for normal or common cold and cough, and it progresses with time in severity. The severity increases with time. That is one pointer which can tell that this might be a cancer. This might be a sign of early lung cancer.
Understanding who is at greater risk of lung cancer can save lives. High risk groups require special attention and proactive screening to catch the disease early.
In general population, we should identify who are the high risk people who have the propensity to develop lung cancer, which is more than the common population. Some of them are ex-smokers or current smokers, the people who are addicted to nicotine or tobacco in any form. In these high-risk population, even any small persistent complaint should be evaluated in the line of lung cancer. So, in to those people, my advice will be, if you have any of the early warning signs like chronic progressive cough, coughing out blood or hemoptysis, pain in any area of the chest that is persistent and progressive, that stays at its site and it gradually increases with time. These signs can indicate the risk of lung cancer and should be evaluated first. For the other part of the population who are not seem to be at high risk, there are guidelines for that. In any case of chronic persistent cough, should be evaluated, undergo a at least a CT scan. If there is a chronic cough, the patient should undergo a CT scan. And the modern day CT scans or high resolution CT, as we popularly call it, is very sensitive, picking up any lesion in the lung that can be a potential cancer.
The causes of lung cancer extend beyond smoking, with passive exposure and environmental factors playing a significant role.
Active smokers or people who take smoke or chew nicotine or tobacco products, that habit gives rise to lung cancer. That is, all of us are well aware. In non-smokers, there can be a tobacco exposure in form of secondary or passive smoking or tertiary smoking. Lung cancer that is not related to smoking might be due to environmental exposure like low dose radiation or other chemical substances that are carcinogenic. Some of it has been published in the IARC potential carcinogens list. The important fact is that the non-smokers developing cancer, this can be detected at an early stage, at an early time, and the prognosis in non-smokers developing lung cancer is usually better than those of smokers. So, for them, we should screen the population that are at a higher risk at regular intervals.
Lung cancer research has seen major breakthroughs in recent years. Let's explore how advancements in immunotherapy and targeted therapies are revolutionizing treatment.
In fact, the most of the groundbreaking research that is going on in oncology is in the field of lung cancer. If we see the developments in last 5 or 10 years, immunotherapy or the immune checkpoint inhibitors play a very vital role in managing lung cancer nowadays. So also the research regarding the tyrosine kinase inhibitors or the tablets that we use mostly in treating lung cancer in non-smokers or in females. That has also gone a great deal of that information. These are the things that are these are the knowledge that is available in treating lung cancer, mostly immunotherapy or immune checkpoint inhibitors and tyrosine kinase inhibitors or TKIs.